Assalamu alaikum. This is Dr. Ingrid Matson. I am the London and Windsor Community Chair of Islamic Studies at Huron University College. And today I am here with Dr. Nour Akhras, who is the head of Pediatric Infectious Diseases at AMITA Women and Children's Hospital in Illinois, and with Dr. Wael Haddara, who is the Chief of Critical Care at London Health Sciences Center and Chair of the Division of Critical Care Medicine. Assalamu alaikum. Today we wanted to just talk briefly about the state of the pandemic from the community's perspective and the role of vaccines in preserving health and preventing transmission of the disease and very adverse outcomes. So can you just briefly summarize, Dr. Wael, where are we these days? We hear a lot about the Delta variant. We hear that vaccines were intended to prevent the continued spread of the disease. So where are we right now?
I think we're very frustrated is where we're at. It's been a long, hard slog, and I think a lot of people had hoped that this would be over by now. It's been, well over a year and a half of this. What we're seeing, though, is what a virulent viral infection that is very infectious looks like. A lot of transmission, and with the transmission, with increased transmission, the virus does change. Now, it has always changed over the last year and a half, but every now and then we see a change that leads to more infectiousness or to more severity of illness, and that's what's happening with the Delta variant. The Delta variant is not going to be the last so-called variant of concern that we see. This is what happens with viral illnesses like this when they spread so significantly or so widely. But the big advantage that we have now that we didn't have a year ago is the vaccines do work, and they do work against severe disease that results from the Delta variant, and will likely continue to work against most variants that arise. So the vaccines are highly effective. The last estimate is around 88% effectiveness for the Pfizer vaccine or the Moderna vaccine against this the so-called Delta variant. So it's been a long journey. It's a difficult situation for everyone, obviously, but in North America, we're extremely blessed to have so many options for protecting the community, protecting individuals, and that's the vaccines.
Right, great, thank you. Nour, Nour Akhras, a lot of people are confused because they hear, for example, about breakthrough illnesses among people who are vaccinated. And sometimes it's at a very high level. And I realize that many older people who tend to be susceptible to illness, who may not have as a robust immune response to the vaccines, that might be one reason why we find in some cases some high numbers. Can you explain what a breakthrough is and why some people might be susceptible to that more than others, even if they are vaccinated?
Yeah, so the breakthrough rates, a breakthrough infection is when you're vaccinated and 2 weeks after your last vaccine, and then you still get infected with COVID and sick. So there are some people who are still getting the virus, but maybe not getting sick. But the people who are getting sick are having what we call a breakthrough infection. The rates of breakthrough infection are actually still very low. They're probably less than 5%. So less than 5% of people who are vaccinated will get a breakthrough infection, but we're hearing about it because that's news, right? So people want to say, look, the vaccine doesn't even work. People are getting breakthrough infections, but actually the vaccine is working because these people who are getting breakthrough infections are not getting hospitalized or not getting super sick or ultimately not dying of COVID. So one of the reasons people are getting breakthrough infections is because the Delta variant is so transmissible and so contagious. And so people are getting high viral loads in their noses where the virus initially replicates. But part of the vaccine's job and part of its efficacy is that it controls the virus from getting into our lungs. And that's where we don't want it to be, because that's where most of the damage is happening from COVID, in the heart or the lungs, mostly the lungs, and then the circulatory system. So, so yes, breakthrough infections do happen, and they will continue to happen. But the important message here is that the vaccine is preventing the death from COVID, even with breakthrough infections or severe infection with COVID, when you even do get infected. So I actually had a family that I just took care of. The adults in the family got breakthrough infections, and then the child who was under 12 was not able to get vaccinated. That child was hospitalized. But the mom, even though she had a breakthrough infection, like 2 or 3 days into it, she said, I feel 90% better. And that's because she was vaccinated. Whereas her child was in the hospital for about 4 or 5 days with COVID. So vaccines work. These vaccines are very efficacious, but we are still going to get the breakthrough infections just by nature of how vaccines interact with, how the virus interacts with people.
Right, great, thank you. Dr. Wael, in addition to being the chief of critical care and having over the last year and a half seen your hospital filled with very sick people, you also have a degree in pharmacy. And so I want to ask you a little bit about vaccines and why we need them when our bodies have an immune system, and what you're seeing in terms of the practical effect of these vaccines in the hospital. Why should we trust these vaccines more than, for example, our own immune system?
Sure. So, infections are infections. We have bacterial, viral, and other infections that we've seen over the course of the history of humanity, and we've seen entire societies decimated by these infections. I mean, the indigenous populations of North America are a prime example. And so, these were people who were very healthy. They're very much in touch with nature. But when a serious infectious disease comes along, our natural immune system is simply not built for that, at least not without some help. And so what vaccinations do, or what vaccines do, is they help our immune system then have a memory of those organisms. And when they do come along, instead of it being the first time that we're seeing these pathogens, we now have an innate, it is our immune system that is revving up and is able to fight these infections. So I think there's a bit of a misnomer there or a misconception out there that because I am healthy and well, and I eat well, and I eat a lot of fruits and vegetables, and I exercise, that somehow translates directly into a natural immunity. Certainly, people who are healthy are able to fight or survive an infection more, not because of their immune system, but because the rest of their body can take that hit, well. So, I think that misunderstanding does need to be discussed and confronted. Being healthy, having a healthy body, having a healthy lifestyle is not a match for streptococcus infection or COVID or something along those lines.
Right, thank you. Dr. Akhras, so how should a young person, a young adult, think about their own risk? I know that there are a lot of young adults in their, say, mid-20s to mid-30s who look at the numbers and are trying to outweigh the risks of getting COVID with any unknown risks of the vaccine. And these are young people who are, say, at the stage of life where they're thinking of beginning families, and they're worried about, is there enough evidence that it won't harm my fertility, for example, or that if I get sick from the vaccine, that, that might not be worse than getting sick from COVID. So how would you, from your perspective, how should young adults weigh the risks of the disease versus the vaccine?
Yes, that's a really good question. So we do know that people who were enrolled in this study, Pfizer and Moderna, who were not pregnant before the study, actually got pregnant during the study, people who received the vaccine. So obviously didn't affect those people's fertility. And the American College of Obstetrics and Gynecology has come out really strongly saying that there's no evidence that these vaccines affect fertility or affect the uterus, affect any of the organs involved in reproduction. And actually pregnant women are at very increased risk of getting very sick with COVID. So it's really important that they, of all people, get vaccinated during pregnancy, and actually that immunity will be passed on to the baby and during breastfeeding. So that's multiple gains there for a pregnant woman to get vaccinated. Now, if we talk about people outside of that scope, outside of pregnant women or women who are thinking about their fertility, just young, healthy adults, one of the reasons for me that COVID was really scary back before the vaccines, I mean, it continues to be scary, but for me, it was that we just didn't know. Yes, the risk for young, healthy adults was very low to get very sick with COVID, but there were people who got ravaged and killed or died from COVID. And we just don't know. There's no, we don't have the science that tells us why this young, healthy person got very sick from COVID and died. And that's the same thing happening in children. Yes, the risks for children are very, very low, but there are some young, healthy children who are dying of COVID, and we just don't know who those people are. So in vaccine history, we know that most serious adverse events that are going to happen from a vaccine happen within the first couple of months. So the people who were in the vaccine trials have now been 18 months out. And we just haven't seen those serious adverse events happening to these people. Yes, there is a risk of pericarditis and myocarditis, which I'm sure people have heard about. And that's inflammation around the heart. And it's happening more to young, healthy males between the ages of 12 and 30. The CDC has documented about 300 cases of that against 300 million cases of immunizations. And when you get inflammation of the heart of this pericarditis or myocarditis, you'll have chest pain, and then you get hospitalized. And most of the time you do very well with fluids and pain medicine. And any viral infection actually can cause myocarditis or pericarditis. But the risk of dying from COVID is 100 times more than the risk of getting pericarditis or myocarditis from the vaccine. And when you get COVID, you actually can get myocarditis and pericarditis. And so your risk of getting COVID and getting inflammation in your heart is higher from getting actual COVID than from taking the vaccine. So, taking the vaccine, we haven't seen any serious adverse events 16 or 18 months out now. But also we don't know what the ramifications of COVID are. COVID is a brand new, SARS-CoV-2 is a brand new virus. It's only been around for about 2 years. So we don't know what the long-term effects are. But one of the scary things is that when we see patients with COVID, even if they look like they have mild COVID, they're walking around on room air, their CT scan out of their lungs is horrible. It's awful. And we don't know in 5 years if their lungs are going to become fibrosed or hardened such that they can't breathe. So I think that, I know there's a lot of skepticism or maybe distrust of pharma or, maybe the medical industry, but me and Dr. Wael, I'm sure have no vested interest in pharma or either vaccines or all three of the vaccines, or there's multiple vaccines out there now. And I wouldn't tell people to do things that I wouldn't do myself or do for my children. I mean, this is how I treat children. I wouldn't recommend something for somebody's child that I wouldn't do for my own child. And I had my 12-year-old got vaccinated as soon as the vaccines came out for him. My whole family's vaccinated. All of those who can be vaccinated have been vaccinated because I really believe strongly in the vaccine efficacy. And I want to do everything I can to protect my family from getting COVID, especially getting long COVID. And that's another thing we've been talking about, that people who are not getting seriously ill with COVID, so just getting mild COVID, there's a subset of people who are getting long COVID. So we call them long haulers because they suffer from fatigue. They suffer from fog, a brain fog. They can't think straight. They have like, sometimes they'll have tachycardia. Their heart is racing, even though they aren't doing anything. Sometimes they'll have shortness of breath, even though they're not doing anything exertional. And that's happening for 6-8 months. And the psychological impact of that alone, not even talking about what it's doing to bodies, but the psychological impact of being like, oh my God, I'm not, like some days they'll feel fine and then it comes back to them, which is very difficult psychologically. Like you think you're finally out of the woods and then there you are back at it. So the psychological impact of having long COVID is very high, very strong. And I just think that, you know, we haven't seen serious adverse events from the vaccines. And I don't think I could recommend the vaccine enough. I really don't.
Right, thank you so much. Dr. Haldara, what do you say to young people when they're trying to assess the risks?
Yeah, no, so I think the points that Dr. Akhras makes are right on, right? We can't make decisions in isolation. It's not about, do I get the vaccine or not? It's about what my options are. And the options are being susceptible to a COVID infection, not necessarily getting it, but being susceptible or getting the vaccine. And on the susceptibility piece, I mean, I think we need to remember that the ultimate goal of vaccination here is to go back to normalcy or as close to normalcy as we can. And that means increased contacts with people, significantly more increased contacts. And so, you know, the volume of cases will rise. And so in protecting ourselves and also breaking that chain of transmission so we can help protect others, is really important. And if we don't do that, then we will never be able to open up back to the same level of contact that we had before. Then really, it doesn't matter what governments say or do on this front. In the UK, for example, as we all know, the government has decided to lift almost all COVID restrictions on July 19th. And the recent survey just a couple of days ago showed that less than 20% of people have returned to work in person. And in some UK cities, that number, that proportion is in the single digits, less than 10% have returned to work, even though from a government restrictions point of view, they've lifted all of them. But people have an intuitive appreciation of the risk. And as long as we continue to have a substantial proportion of the population that is unvaccinated, or we continue to have a circulation of the virus at high levels, then we will not be able to go back to normal. That's one point. The second point, which I feel is also fairly important, is that we need to address the elephant in the room, which is what is the source of the COVID information that we're relying on. And we can't ignore the fact that study after study has now shown that a significant portion of the misinformation, not all of it, but a significant portion of the misinformation is really peddled by people who have a vested interest in breaking our societies. You know, either foreign powers that are really trying to destabilize North American societies, both Canada and the US, but also people that are making money off of this. You know, I think a recent study showed that almost all COVID misinformation can be tracked down to 14 Facebook accounts. This is on Facebook. And the amount of money that people generate from these posts is not small. So when we talk about mistrust of pharma, which I think is justified, and mistrust of government, which I think is also justified, that does not equate to trust in those other sources. And people have to be, you know, I think people are being critical of pharma rightly. They should also be critical of where they get this other information.
Right. Well, I always say, you know, when I'm talking to people about how I make the balance and what information I rely on, I always say, well, I have two friends, Dr. Haddara and Dr. Akhras, who are experts in this area and I know very well, I've known for years and I trust will give me good information. So for me, that's really important. Thank you for speaking with us about this today. And I think we'll continue a conversation in part 2. So thank you. Assalamu alaikum.
Right. So-
Alaikum salam.